300,000 deaths and counting. While many have chosen to dismiss the reality of COVID's chokehold on the US, thousands of Americans continue to die every single day. The frontline healthcare workers who've been forced to face the virus head-on are overworked, overwhelmed, and overlooked. I sat down with a pediatrician named Dr. Sheri Rocco, who's been working on the front lines of this pandemic.
I'm Dr. Sheri Rocco, a pediatrician, and I've been a pediatrician for 20 years. So as a pediatrician, I see patients from the minute they're born until they're ready to graduate and move on to adult medicine.
As the country heads into the next wave brought upon by the winter season, Dr. Rocco shared with me the unique challenges of a normal flu season complicated by COVID-19.
Influenza is a virus that comes every year. It's typically a respiratory virus, but also affects other body systems as well. Flu season for us in this climate starts in October and then goes until about April. It always hits like clockwork in our area of the country right around Christmas. Since it hits right around those times, we want to make sure that we have vaccination in at least 30 days prior to the peak. So typically we shoot for vaccinating people in October. The influenza vaccine will not prevent all cases of influenza, but at the youngest ages and the oldest ages, we have our highest rates of complications, hospitalizations, and fatalities. To be clear, everyone should get an influenza vaccine unless you have a very rare contraindication to receiving the vaccine. Influenza vaccination rates this year still have a fairly good penetrance, but I have to say I'm getting a lot more resistance than normal. The patients that choose not to get their flu vaccine, it's interesting. There is a multitude of reasons that I'm hearing this year. Many of them are new this year. Some people don't have a very clear reason as to why they don't want to get it. They just know that they've heard from friends or family or social media that they shouldn't. So for example, sometimes patients will tell me that they're afraid that they're going to get influenza from the vaccine itself. But we talk about how that is physically impossible. They take the influenza virus, they remove certain proteins, and then those proteins are put into the vaccine. You are not getting a live virus, and it's impossible to actually get influenza from the vaccine. What's much more likely, because influenza is a common virus, that you got a vaccination, but you happen to get in contact with it before the vaccination took hold. So in the week, for example, after you've received your vaccine, it's not going to work yet. And so they got it from somebody else outside of vaccination. So COVID is what's called a novel virus, meaning it's new. And quite honestly, it has really wreaked havoc all over the world, but especially in the United States. As a new virus, there's so many things we don't know. We don't know why it hits some people much harder than others. We know some of the risk factors, but certainly not all of the risk factors. And there's so much to still discover about this virus to be able to give very clear, educated guidance to our patients. This will be the very first time that we will have patients with both COVID and influenza. That's a scary place to be when you've never had experience on what that will look like, how to treat it, and how bad it can be. So in my opinion, one of the most important things we can do is get our influenza vaccine to try to prevent that serious potential combination of viruses that could really significantly harm someone. I don't actually see parents as concerned as I think they should be. And in fact, that's something I often bring up to parents who are thinking about not vaccinating for influenza. I think that one of the hardest things for medical professionals right now is you've got two viruses with very similar symptoms. If we look at the symptoms that each influenza and COVID produce, they are almost identical. And it's hard to tell. And in fact, I would argue I don't know that we can accurately make a diagnosis without actually testing a patient. With that said, the most important thing is still the same things we've been talking about since March: masking, social distancing, and frequent hand washing. Those are our key pieces.